The Center for Indigenous People Health and Nursing welcomes you as we continue our celebration of Native American Heritage Month. We honor the knowledge, resilience, and leadership of Indigenous peoples of the past, present, and future. It is in that spirit that I am honored to introduce Whitney Johnson. Whitney is an enrolled citizen of the Oglala Sioux tribe and a board certified psychiatric mental health nurse practitioner. She currently serves as the tribal liaison and mental health policy and program consultant on the American Indian team at the Minnesota Department of Human Services. Whitney brings a wealth of experience spanning emergency medicine, mental health, substance use, LGBTQ Two Spirit Plus, health, perinatal mental health, and community health. Her leadership and advocacy have been recognized widely. She was named 2018 YWCA Woman of the Year for advocating for equality and received the Outstanding Service Provider Award from the Fargo-Moorhead Coalition to End Homelessness in 2021. She was also featured in Shift Nursing's Who Cares? A Nurse's Fight for Equity. A dedicated community leader, Whitney served on the Fargo Native American Commission from 2017 to 2024, including 3 years as chair, and she currently serves as the board chair for the Indigenous Association. Her work reflects a deep commitment to equity, healing, and empowerment in tribal and urban Indigenous communities. We welcome you and thank you so much, Whitney, for sharing your time and expertise with us.
Thank you for that, Misty, and for the invitation to be here today. I really appreciate that. As you all can see, I have not updated my last name on my slideshows, apparently. I really like this slide deck, so I like to use the template, but I forgot to update my last name. You can go to the next slide, Misty, please. So this is gonna be, I think, pretty casual today, laid back. I do like to preface all these presentations with letting people know when discussing, events from the past and current, issues facing Indigenous people. None of that is meant to, done with malicious intent to try to make anybody feel badly or feel ashamed. It's just simply part of history, and it's part of what affects us. So it's important to talk about. So doing that with a good intention that helps raise awareness and provides other people outside of our communities the opportunity to be helpful to us. So, in my introductions, I also like to communicate that who I am as a person, I'm Lakota first and a nurse second. Being Lakota is who I've been my whole life. That's how I was born, and that's who I'll be my whole life. And that's the most prominent part of my identity. I was born and raised on my people's reservation, on Pine Ridge Reservation in South Dakota. Although I've lived in an urban area now for 20 years, it's pretty hard to believe it's been that long. So I have developed this unique understanding of what it's like to be Indigenous living in an urban area too, and the different challenges that come with that. My professional background, I started out in healthcare when I was 19, working as a behavioral health technician at Prairie St. John's as an inpatient hospital, inpatient psych hospital in Fargo, and then kind of made my way up the ranks, so to speak, as a CNA, then an LPN, then I had my RN, my bachelor's, and then my master's degree. And, I think there's something that's been interesting in transitioning to my role working at the state is I have had people ask, well, why what made you want to work at for the state, and not do clinical practice anymore? Um, it's not that I didn't want to do clinical practice anymore. There was an opportunity presented itself for me to make an impact, like on the front end of things, preventative end of things. And that's something you really come to understand is how important that is when you're working in clinical practice and in that direct care, is how much of that like policy making and all of that really, trickles down and affects people deeply, and how we really need people with clinical expertise on that front end of things, helping make those policy decisions and help guide policy decisions. So that was the reason for my transition into my current role on the American Indian team, which I've been on since June. So you can go to the next slide, please. So, with regard to events of the past, they could spend hours and hours on that, right? There's so much more than just, you know, um, European people came here. We had our lifestyle disrupted, whatnot. There's things that are so much more recent than 200 years ago. It, for example, the Indian Child Welfare Act, the act of legislation that kind of brought for sure like a halt to the boarding school era, and enforced or coerced adoption era. That only happened in 1978. So, there are definitely boarding school survivors alive today. Um, and for our relatives north of that imaginary border, into Canada, that was true up until the mid 90s. So, and people, right? People move, people come to different areas, so you never know, like if somebody is from, up north, or if they're from the United States, the impact that those things have had. In these pictures here, and I like to use a lot of pictures and stories. I was kind of like, well, like half joke, like we're storytelling people, which we are, we really are. That's how I think that there's something really beautiful in that our traditions and our languages survived without being, documented on a piece of paper for that many generations. And I always think it's like so inspiring to hear people like James V. Glitch talk about like how old our languages are. I know, interestingly enough, it was at Bemidji State whenever Misty was still there, that he gave a presentation. He was talking about one of the words for father in Ojibwe, like predating the last ice age, and I like mind blown. That's amazing. Um, so these more recent events, right? They are just as gritty as the ones in the deeper, more distant past. Um, and sometimes people have seen some of these pictures, right? Like, so I think a lot of people actually have seen that picture on the top left, and that is the former chairman for the Mandan, Hidatsa, Arikara, or three affiliated tribes, Gillette, weeping as the transaction needed to finalize the land deal, so to speak, was concluded to begin construction of the Garrison Dam, and that was profoundly impactful for the people. For those of you who are not familiar, those tribes were extremely advanced farmers, and the Garrison Dam, the construction of the Garrison Dam, completely destroyed so many acres of farmland because of flooding and things like that. So there were places where people had lived and occupied for since time immemorial, right? It was wiped out by that dam. Um, and I've heard from elders from that tribe, that there were even some of the men they went to war and they came back and their home was completely different. And that was just heartbreaking to think about. The bottom left picture, some people have seen as well. That is people being buried in a mass grave after the Wounded Knee Massacre. This one is a little more raw to me than it usually is because the current Secretary of Defense, Pete Hegseth, reinterring or reaffirming the award of medals of honor to soldiers who participated in that effort, and how the language has shifted back to like that being a battle, because of it was indeed not a battle. It was um, what we as people, despite what other people may say, what we will always remember is that was a massacre. That was elderly women and children and sick people. And they certainly did not have the kind of artillery that the U.S. cavalry did to defend themselves. And in my mind, that's not a battle, right? The other two pictures people may not have seen. I know the top right one, definitely nobody would have seen that, other than people in my family. That is a picture of my grandma Becky's boarding school class from the Rapid City Indian School. I actually happened upon this picture as I was looking through family photos. It was like stuck to the back of another photo that was in a frame. And I don't know if that was done intentionally, um, because it was maybe painful to look at. It was kind of like it's kind of like a postcard style photograph. And I kind of, as I was looking at that, I was just imagining like I mean, I'm sure that the people who sent it did not feel they were being cruel, but I imagine how cruel it must have felt to my, her mother, my great grandma Kate, when she got this postcard in the mail, because looking at the faces of those girls, they look so sad. They don't look, like they don't look like a bunch of little girls that are having fun at school, right? And knowing the legacy of their Rapid City Indian School too, how many children died there of tuberculosis. So many died that they had to turn it into a sanatorium. And it wasn't that long after my great grandma Becky was there that they did so. So I think she's pretty fortunate to have survived that experience. Her and my great grandpa both were at Rapid City Indian School around the same time. And then on the bottom right, you know, people may have seen it's on the Carla Indian Schools website. Carla Indian School in Pennsylvania was where my great grandpas went to boarding school too, and a great uncle went to boarding school. And there is a group leading a good effort to try to bring people, students, that passed away there home, to their people, and also make sure that the descendants of the students there have the records from their family and their loved ones. So this is a picture of my great grandfathers, Harrison and Philip, and I say grandfathers because my my great grandmother was married to one of the brothers at first, and he passed away only 8 or 9 years into their marriage. And in our ways, traditionally, if your husband or wife's younger sibling or older sibling is not married, it is traditional to then for them to partner with you, because in our ways we don't marry just one person, right? Our families marry one another, and that's actually really common with a lot of indigenous people. My husband's Anishinaabe, from Belcourt, from Misty's neck of the woods, and when we got married in the traditional way, and that's what the person who performed the elder performer ceremony was talked to us about, how our families were marrying one another. We can go to the next slide, Misty. Kind of why talk about, history of things. And for Indigenous people, it may be on this presentation. Some of this stuff may seem, like reiteration of things you already know. maybe those aren't things that you know much about. Maybe, a lot of us, too many of us grow up distanced from our culture and traditions, whether that's physical distance, whether that's, emotional distance. There's a lot of pain, for people, are those who came before us, those who went to boarding school and things like that. It can be very painful for them to try to reconnect with their culture. And my grandma, had a difficult time with that. She really struggled with trying to reconnect with her culture, but also having some fear of it. Her father, which was one of those little boys in that picture on the previous slide, he was a success story in the way that boarding school wanted them to be. He came out of Carlisle hating himself for who he was and not wanting his children to have anything to do with their culture, their way of life. I think the only reason that anything persisted, as far as traditions being handed down, was that my great grandmother was a rigid traditionalist, and as her first husband passed away, she was able to give a little bit to her children, in between their own time at boarding schools. All of their children went to boarding school as well, my grandma and her siblings. And then when her second husband passed away, then she was able to give them some more as well. So I think, I've worked with a lot of boarding school survivors too, and a lot of them have, told me about, how painful it is, how they feel, kind of stuck, like they don't know enough to um, feel like they have a complete identity, in that traditional sense. But they also don't feel white either. So it's a difficult kind of in between place to be. Um, and so sharing history, I think it really helps, people who work with us, again, like people who may be allies, to understand the depth of those events and how much of an effect they've had on things. Because I've definitely been in a lot of spaces where people, professionals that had no idea what boarding school was. I remember the first time I ever asked that question at a nursing conference in North Dakota, and this is a room probably 200 some nurses. I asked if anybody knew what boarding school was, and three hands went up, and there were three women from Fort Yates. So of course they knew what boarding school was because they were native. So I mean, but otherwise it was like crickets. Nobody had any idea what I was talking about. And I thought, wow, that's really something because, that conference was in Bismarck, and I was like, man, like the nurses for sure working here in Bismarck are definitely working with Native people because there is a reservation 40 miles away from here. Like this is definitely like where people are getting life flighted to, right? All those kind of things came to my mind. And those things from the past are shaping our future. And our peoples have talked about that for a long time. I definitely don't want to overgeneralize and say this is every Indigenous person's belief, but I will say I've yet to happen upon an Indigenous person who said, no, we don't believe that, right? And that belief is that everything that happens has this ripple effect throughout history into the future. And that's why, I feel like, again, I can only speak from my own experience, my own culture. I feel like that's why it is so profoundly important to us to be a good relative and to shape our lives in a good way, so that our descendants have a good example of who they should be, that they want to be, live in that way that we lived. And that's something that I think of, when I'm trying to think of decisions and things that I do. Is this staying true to what my ancestors wanted? Is this who they wanted me to be? And in current times, we've given, the effect that the past has on the descendants of people. We've given that, science has given that the name intergenerational trauma. And we're seeing the science of that, right? We're seeing that the telomeres, protective coating around DNA, our chromosomes are affected, by having, that intergenerational trauma. We're seeing, we've described something that referred to as secondary traumatic stress, or being able to have similar effects to, a loved one caregiver that directly experience an event, that storytelling that they do, or through their own mannerisms and their own behavior. Um, but, when I think about all of this stuff, it all began 500 years ago. So there's been 500 years of those kind of things going on. And I think we'll just find out more and more as time marches on. Yes, you can go to the next slide. So here is my grandmother and all but one of her siblings in that left picture. Um, and actually, so only one of her siblings is alive today. Two passed away from complications, alcoholism, one from domestic violence, and everybody else but the one has died from cancer, and prematurely. So like I said, all my grandma's siblings went to boarding school. My youngest auntie did not attend boarding school for very long, less than a year. Um, and that was because of the Indian Child Welfare Act. And I think, what's notable talking about this is there have been some recent studies that talk about the physical uh, effects on descendants of boarding school survivors, and how all these kids in this picture, their fathers were boarding school survivors. Their fathers were at Carlisle, and their fathers were, greatly psychologically affected by that. They were there for a long time, several years. And um, unfortunately, when I was talking about my grandfathers and a great uncle attending boarding school, my great great uncle did not return from Carlisle. He passed away at Carlisle at the age of 19 from measles. And they had a funeral, they buried him, everything, and they didn't notify his parents for several months after he died. And they insinuated at that time that they had caused his measles by sending him a letter, which, for healthcare professionals in the room, how likely is it that measles survived on a letter coming from South Dakota all the way to Pennsylvania in the late 1800s? I don't think that mail moved more quickly than I think measles lives on surfaces for like 72 hours. I mean, I definitely think it took a little bit longer than that. The Pony Express or whatever, however mail moved at that time by train even probably took at least, a month or so. Let's see if you can move to the next slide. So this word here is the local word for destruction. In the wake of that European expansion, a lot of things were lost for us, and I've already mentioned that. We were no longer allowed to source for the foods that we had consumed for thousands of years. In that place, we were sustained on rations provided by the government. They were heavy on carbohydrates and heavily processed foods. I think a sore spot for me for sure, when I've had to encounter racism against our people that involves alcohol, is the awareness that alcohol was presented to our people by the government as medicine. Was like literally had a label on it called the medicinal whiskey, and it was provided in those rations, and people were encouraged to drink it for like any ailment. You're stressed out, you can't sleep, you're sick, you have a cough, drink this. And how that is again one of those like missing pieces of history. Whenever I hear people speak about those things, it's like, the it's like, how you just don't even know that, like, that wasn't we did not every elder I've ever talked to from any indigenous tribe I've had contact with, and that's now been dozens and dozens from the US and Canada, none of their people ever produced alcohol. None of them. So that was definitely something. I think my opinion is that was something that was introduced to us. We did not have that before Europeans arrived. But our birthing practices, our naming traditions, and celebrations, those are replaced by those Christian and European practices. Yeah. Chief Sitting Bull was once quoted as saying that trying to live like white people wouldn't work, and that we would become neither wolf nor dog. The boarding school era dealt a particularly traumatic blow to our people, because it removed a lot of that language and things like that. I wanted to share an experience that a elder from Spirit Lake told me about once. He went to boarding school in Flandreau when he was a little boy, and he was there for about 4 or 5 years. And he said every time I see that crucifix, because we were at a shelter, we were talking, just crucifix on the wall. And he said, I wonder if the pain that I've experienced is because I haven't you know, tried to make myself the way that they said that I should be at boarding school. But he said, I don't know what to do about it because I don't know if I should still be trying to pray to that guy on the wall because I don't know how to pray the way that my parents did. I don't know how to say those words and do those things. So he said, I guess I can't pray right either way. And um, he said that he had voiced that feeling that, when he would return home on breaks from school, not being able to really fit. And I think I wanted to share those things because I think, when talking about trying to build, equity in this profession, and not just nursing, but other healthcare professions, and in a age where that's a dirty word right now too. Um, you know, that is something that I truly believe that that person could not have talked about with someone who's not native, because like I was gonna have a unique understanding of what he was talking about. He and I had conversations before, about a little kind of like lighter conversation about boarding school. I had shared with him, that my a lot of my family had attended boarding school, and that you know I think at the time that my grandma shared a lot of stories from boarding school with me, I didn't quite understand why she was telling me because she didn't tell very many other people in my family. But I think as people get older, they have a way of knowing who they need to give information to. So although she's not here to ask her today, I really think my grandma gifted me with those stories because she knew that I was going to need them to understand people that had had that same experience as her, so I could help them, be more helpful to them. And of course, for people outside of our communities may think that sounds really woo woo, but that's how we are. We're just like that. And I think that is important to be okay with too. So a lot of those events of the past that create a lot of shame in us and for who we are, and it can live down deep, and we can have a hard time identifying that whenever we're hesitating to speak up or become involved in something. I think it can be because that shame is so deeply rooted that it may not feel like shame. It may feel like anxiety or like, well, nobody's gonna listen, so I'm not gonna bother anyway, things like that. But that it is something that our allies can help with too, in encouraging Indigenous people to be involved in things, to making sure that there is a seat at the table, so to speak, in things that directly involve us, because that has definitely been a big hindrance on our people, is this kind of planning things for us, because to be totally blunt, that they haven't been successful, not a one, and there's been admissions of that. If you want to go to the next slide, Misty. I won't spend a ton of time on this one. This is just kind of a little bit more like kind of pictorial what I was talking about earlier with the Garrison Dam. The bottom photo is a picture of two bison hunters with the thousands of buffalo skulls, and that was a effort that ended up resulting in that removal of a food source for so many people. And but something I find really interesting about that is I have heard that there is some emerging research that points to this eradication of buffalo having like coupled with like the removal of our peoples from like that nomadic lifestyle or following the buffalo lifestyle and traditional farming ways that those being like two deeply profound factors in the development of the Dust Bowl. There's some research being done about that right now. So this may, in fact, have been an effort that ended up backfiring on the people who perpetrated it. Let's see if you can go to the next slide. So this slide is more for any Indigenous nurses or healthcare professionals that are watching students. If not you, then who? Who is going to, be the one who helps our relatives? There's certainly, not enough of us, to do the work. Less than 1% of the nursing workforce is Indigenous. People like Misty are doing some amazing things to try to grow that number. But this it is going to be an uphill battle. And I think I chose this picture. This individual was in that film with me. And he signed all the HIPAA stuff and whatnot. I'm like, you can't take it back now. You're on. This is Demon Smith, and more lovingly referred to as Princess. And he was a participant of a housing program when I was a nurse at Homeless Health Services in Fargo. And I got to know Damon really well. Obviously, he was in a documentary with me. But this is actually the first time he and I ever collaborated on anything together. He and I and another individual of that housing program were co-presenters at the Harm Reduction Conference in Monoma. This was probably like 2 or 3 years before that film. And I was so proud of him and the other individual, the other person. Um, did not want to be on the film. He is very shy, even more shy than Damon is. But they did such a phenomenal job, and I think that was like a kind of a culmination moment of like, yes, this is like what can happen when you like empower people. Because these two guys like know way more about like I've never been without a place to live. Damon grew up mostly in urban areas when he was young, and in foster care, and I didn't have that experience. So they can speak to those things way better than I can, and they just need an opportunity. And so yeah, I think where when I was working at Homeless Health Services, as I think where I kind of finally shed that last remaining like shame I had about who I was. I remember a conversation I had with an elder, and I was talking to him, trying to get advice from him about how to approach some service providers in the area about their interactions with Native people, about how to make things better, um, about respecting, cultural practices and people's like autonomy and decision making, like like even things as simple as like not being so restrictive and who they consider next of kin. Like if somebody says like this is my person, like why do they need to be a blood relative? Like if that's the person that they have called their sister for 40 years, why does it matter? Um, and when I was talking to him, he said, I think the first thing that you need to do is you need to really look at why you're so ashamed of yourself still. And I thought at first I got a little like, I was like, man, that's kind of a like hurts, because I'm not ashamed of who I am. I'm proud of who I am, where I grew up. But when I reflected on that, as this is the person I went into sweat with the first time, and I had my family was very close to, for a long time since I was a kid. I really thought on that, and I thought, he is right. And he said, I told that to you because if you weren't ashamed, you would just walk into those rooms and you would know you're the expert because none of those people probably, are a Lakota woman. You are a life bringer. You're a life force. You're um the backbone of our people, right? A Lakota woman is the backbone of our people. She is the knowledge bearer, the tradition keeper. So you shouldn't need to answer to anybody about our way of life. The only other people you should answer to are other Lakota women who are your elders. And that's if they think that you need to do things a different way. Otherwise, you don't have to explain what you know to anybody else. And maybe that's part of the problem with why they don't understand that people outside our community, because they need to accept that we know things that they don't know, and that what the way them trying to do get us to do things their way isn't working. And so I really did a lot of like internal work on that. And for people, like I said, Indigenous healthcare professionals and nurses, like I really would, implore you to think about that, how deep that can be, because it's good to do for yourself first and foremost, and it's really good for you to do for your people to walk that like really strong way. Um, and it's what we deserve. We deserve that too. Let's see if you can go to the next slide. So in trying to like blend those, these beliefs of ours, and I just put beliefs from, so this is a Chetty Shakumi, that's the Lakota, Dakota, Nakota people, what people outside of our communities maybe would refer to as the Great Sioux Nation. That's not what we called ourselves at all. And that's maybe a good lesson for non-Indigenous people in here is question what you call people and is it the right name? Because Sioux is certainly not the name that my people call themselves, just like, the Dene do not call themselves Navajo. Um, and there's lots of examples of that, all over the US. And so then I also took the Anishinaabe grandfather teachings too and put them on here. So when you think about healthcare professions, nursing specifically and the values of that, you can see why it's not really a stretch, right? To connect those because it's things that we already know. And for our potential or current allies listening to this right now, you can see how an Indigenous person could come with so much of an inherent strength to this profession and to other healthcare professions because this is who we are. It is not something we have to learn. It is how we live and act and behave on a daily basis from the time that we were able to have behavior and speak and whatnot. These things are deeply ingrained in our everyday life, and they can't be they're like non-negotiable, right? You can't uh, that's the way spirituality is. It's different from religion in that way. You can't negotiate spirituality because it's part of who you are. It's your essence. It's um, unremovable. Um, and I believe honestly that's why it's so present today, is because as um, try as though they may, the people who led the effort for our eradication were not successful because of that being so deeply embedded in us. You can go forward, Misty. I was just going to ask you to do that. Um, and really looking at too, those concepts of wellness. I think that a lot of these colonial based ideas of wellness are on their way out, right? We're not really using some of these things anymore. We're not using like, well, the provider makes a plan and tells the patient what to do. No, we know that the best kind of plan for our patients is one that we make with them together. They're more likely to be compliant. And that's not just Indigenous people, that's all people. So that, like a mutual goal setting, that motivational interviewing, right? Those are all things that are like already have been a thing in the Indigenous concept of wellness for forever. And, like I said, as we move out of that, and we're moving out of those the colonial ways of doing things with wellness and move into back, into these other ways of doing things. Again, think about how your Indigenous colleagues and not just people Indigenous to here, but to other places too. I once had um, took a group of nursing students from NDSU to have an experience with me. And there wasn't any Indigenous students in that group, but there was a Nigerian nursing student in that group. And I took them to a powwow. And that at the end of the night, she said, "This is the most, like, she's like, my heart is just so full. This is the best time I've had since I left home. This is exactly how things are at home, like with my people." And she was the star of the show, you guys. I mean, she was laughing with all the aunties and grandmas. She was getting the little grandpas their cups of coffee, and she was dancing with kids. I mean, she immediately, right? Like, even though her people are across an ocean on a completely different continent, she was immediately able to know, like, I know exactly what to do here because these people are very, very similar to mine. You can go to the next slide, Misty. So, something for both Indigenous and non-Indigenous colleagues is remembering all those strengths. I think a big problem with the way that medicine is aimed at our people is that it's a deficit-based model. And then, like if you're already looking at people who have some emotional pain they're reconciling and live in a difficult environment and you get told you're hopeless. I that in all honesty, I really struggled as a young person. I started drinking heavily when I was in high school, and I almost failed out of high school because of I didn't have any, like focus on school. And I did think about that a lot. Like what does it matter? Like I have friends that are killing themselves. Like I have friends that are moms already. Like what is the point of like even trying? Because like I attend more funerals every year than I do celebrations, like by far. Like at 15, I'm a pro for at helping cook for 200 people at weeks. And so those things like, yeah, if you're looking at deficits and just being told all of your deficits all the time, that's what you're going to believe. But like we are a surviving people. We have some of the oldest languages in the world. Um, we're honest people. We really I would say to an extent that sometimes um is difficult for people outside of our ways to, and I'd say it's like the opposite of like the Midwest nice. People in Minnesota call it Minnesota nice, North Dakota people call it North Dakota nice, where you kind of tell white lies that Native people won't tell you a white lie. If we don't like your potato salad, we're going to tell you we don't like it. And you're like, why did you put that in there? I don't like the taste of that. But if, if we do that because we believe it's disrespectful to a person to lie to them, even about small things, because you're chipping away your own character and you're almost putting it like I don't think you can handle me telling the truth about how you feel about my potato salad. And that kind of degrades the person you're lying to, right? If you don't think they can handle such a little thing. And you think your friendship is that fragile, right? That it can't survive somebody being honest with you. Um, and we're naturally altruistic. It's again part of those traditions, that those traditional ways of life that are essential and non-negotiable. Um, Everything is a relative, and everything, we when we gather medicine, the plant medicines, we ask permission to gather those, right? We're asking, can I have this? Can I take this? Thank you. We're giving that thanks. Um, because nothing should have like there's no hierarchy in who matters more. Because we're trying to live in a balance, exist in a balance all the time. Uh, so, you know, we have this collectivistic, societies where, what is best for all people. That's what we should be doing, not what's best for the individual, because we all have to live together. Um, and I know that can be a little bit of it does not jive with capitalism, that is for sure. And um, the capitalism, I would argue, doesn't jive with being a human being. Um, I put a quote on here from my longtime mentor and friend, Kim Sieb, who I worked with at Homeless Health and has been a good friend to me since. Um, that's something I've always loved about Native people is everything you do has a purpose. It's done for a reason. Um, and when she said that, I was like, yeah, it's true. I mean, it is. Everything has an intention and a reason. And, um, that I think, is really important. And go to the last slide there, Misty. Um, so I wanted to again put up a couple more pictures there. The top left is my great grandmother, Esther, who, without her persistence as a traditionalist, none of our culture on that side of the family, my mom's side of the family, would have persisted. She was an amazing matriarch. I heard that nobody in that housing project would have ever went hungry or without a place to stay, because of her and the other elderly, older women like her. They were kind of a holdouts, those traditional ways of life. That's her with my mom and my uncle, my grandmother, and my my oldest cousin Henry. Then that's a jingle dress on the top right. My sister's jingle dress that she made after she achieved sobriety from meth. This is a big deal. Top or bottom left is my son helping make buffalo soup for my niece's naming ceremony, and my little blonde-haired Lakota boy. And on the bottom right is one of a Lakota leader with my ancestor, Chief Littlewood. Um, and that's all I've got. I'll answer some questions. I'm not even as mean as I look.
Thank you so much, Whitney. That was so awesome. I don't care how many times I listen to you present. I always learn something new and profound. And thank you. And yes, I agree. You are not mean at all. We have that look of stoicism. We just can't help it.
It's
Um,
true. It's true.
if folks have questions, if you want to put them in the Q&A box, that would be awesome. Um, let me think of a question while we wait um, for folks to think of their questions. You spoke a lot about boarding school survivors and resilience, and one of my pet peeves is that we're always put in a place where we have to be resilient. How do you how do you teach people, or what kind of advice do you give patients that feel exhausted from always having to be in these positions of survivorship or resiliency?
I think, just again, like kind of looking on that concept of really, being always being honest, and being a true person and not um being someone who's, I feel like for me that's being somebody who's not going to say, oh, it's okay, or that I think sometimes people need to hear like that's really terrible. That's not fair. That's not how things should be. You know, um, I talked to some tarot, yeah, I think it was tarot, yeah, that say first generation college students program. That there is. I went and talked to some students at that at NDSU, and it was students from NDSU, UND, I think Minot State. And one of them caught up to me afterward, and it was a girl from one of the reservations in Minnesota, and she was a senior nursing student. And she was just like, I'm just, I've had a really hard time. I just, I don't think my faculty really understand like how hard things are, like where I came from. Like I lost my dad and my brother to opioid overdose, like while I was in this program. They seem like upset with me that I keep having these losses and like I didn't want to have them. And she said, I feel like I'm just, I'm in my second to last semester and I'm having a hard time like, kind of working through it and, like what do you think? And I just told her, I'm like, that's awful. That's really awful that you've had to choose between mourning your family members, your loved ones, and um and an academic program. It's that teaches you that you need to be compassionate to people and patient with them, and that when people shouldn't have to hurry their loss along. Can you imagine if a nurse is in the room with you and they were like, let's wrap it up here, Gertrude. We know your husband died 5 minutes ago, but we've got to get going here, like I get that'd be terrible, right? We'd be like, as faculty be like, fail, I would hope so. Like that, you can't talk to people like that. That I said, what I want you to know though is that the reason this is happening is because these systems we were never supposed to be able to get through them. We weren't. So it's um I think probably there's some faculty that they are intentionally biased towards you in not a good way. But maybe there are many that just truly do not understand you because they come from a different way of thinking than we do. And, we, it's not fair to you that you have to, study people through that or help them along or, have that treatment. But I want to tell you on the other side of this is a degree in your hand in less than a year where you can make such a profound impact. Your people need you. They really do. We all do. We all need you. We need you to finish this program. We need you to get that license, because you can be a leader to help people that don't understand us and the things that are happening, and you can do it. I know you can. If you've done all of that already and you are still in this program, you're not on probation, like you're set to graduate, you can do it. And it is going to be hard and it is unfair, but you can do it, and I believe that you can. Um, I think sometimes that's, you know, more what people are looking for other than like a, you know, reassurance that it's going to be okay. I think sometimes people want to know like the nitty-gritty truth of things, so to
Yeah.
speak.
Yeah. We have a couple of questions. First one, the impact of boarding schools in my family resulted in multiple generations being disconnected from our culture, values, and language, and those not being transmitted to the family. I have been trying to reconnect through language, learning Dakota, but wondering what other suggestions you might have for those of us trying to find the way back to our Indigenous values and reanimate them within our lives.
I'm glad to hear that you're doing those things. First of all, that's so important, and that's like stuff gets actually. I'm not a crier, and but that stuff does kind of get me teared up to hear because it's so beautiful, and it's really important. It's more important than you even know how. And your ancestors would be very proud of you. They are very proud of you for doing that. Um, look for your people. you know, be, brave and humble in that way, and some people may not accept that right away, but but don't take that personally, okay, because there's lots of people dealing with that pain in a different way, and sometimes that's to exclude people they feel like are a threat to that. Like they got to protect it, right? That's what we would call kind of gatekeeping. But know that they're not doing that personally towards you. That's something that they're doing because they're in pain. And that's what I mean by saying reconcile your own pain, right? Your own shame and things, because it can hurt one another too. We can hurt one another with that. And I've seen that happen, unfortunately. But also, be open to, though your people maybe not always being Dakota people. Like I have a Arikara uncle. There's an elder in this community that I came to know really well, and I ask him for advice, and we talk about things, and we're not even of the same people. And I always joke around. I'm like, you should be more mad at me for the Lakota people weren't very good to people historically. I have some, really good sister friends that are Anishinaabe. And and there is there's a like a good feeling in that because even though we may not have a language in common or exactly the same value or ways of doing things, you can just be present with those people in a way that is different than you can be with anybody else, and that is important too and will feel good. And like email me like if you want to. I'm not Dakota, but we're cousins anyway, right? So I mean like just look for your people and expect that it may not always go well every time, but when it does, it's because those are the people you're supposed to find.
Awesome. Thank you for that. There's one comment left that I think will be perfect to wrap this presentation up with. But I just want to say Chimigwich, Pilamiaye for your time, Whitney, and sharing with us today. So this comment says, I just wanted to share that watching your documentary was the spark that made me brave enough to apply for the DNP program at the University of Minnesota. So thank you, Whitney. And thank you all for joining us today. And yeah, have a great day.
Thank you so much, everybody.